The genetic disorder that I will be talking about is called Krabbe disease. Krabbe disease is when a person has a shortage amount of an enzyme that your body needs called GALC. GALC makes and maintains a substance that protects your nerves. Without this protection, cells in the brain will die, which leads to the body not working properly. Krabbe disease can be found on chromosome 14 and is also a recessive gene. This is seen mostly in infants, but can also develop later in life. This is known as early onset or later onset. About 1 in 100,000 are affected in the United States, and this is usually seen in people with Scandinavian descent. The symptoms for early onset are feeding problems, fevers, persistent vomiting, loss of head control, irritability and excessive crying, poor coordination of movement or stiffness, seizures, muscle spasms, especially arms and legs, changes in muscle tone, deterioration of mental and motor functions, deafness and blindness. The symptoms for later onset are progressive loss of vision leading to blindness, difficulty walking, poor hand coordination skills, and muscle weakness or rigid muscles. There is not a cure for Krabbe disease, but there are some treatments to help alleviate their symptoms. There has also been found 2 procedures that may have an effect: bone marrow transplantation or cord blood transplantation. Infants who develop Krabbe disease will die before age 2, but the older ones that develop this will die between ages 2 to 7, usually.
Lily was developing normally. She was moving her limbs. She had pretty good head control. At about 4.5 months, we started noticing that she was getting very stiff. I was breastfeeding at the time, so I started eliminating things from my diet, thinking that it was tummy issues. It was at that time that I had to do a developmental milestone checklist, and I noticed that she could no longer do some of the things that she could have done the month prior. When her cry changed, she started with a really, really high-pitched cry. And I immediately called some of my friends that happened to be pediatric nurses, and they said, that's not a good sign. You need to get to an ER immediately. We went right into the ER. We were met back there with a neurologist who took us back, and we did a CT scan, and we had results knowing that there was white matter on the brain, something I'll never forget hearing. That evening, we were given the diagnosis of Krabbe.
Krabbe disease is a fatal condition that is due to a mutation in a gene that produces an enzyme called galactocerebrosidase. What happens after you have this disease is that your brain demyelinates, and then you start having symptoms such as a lot of irritability, you get tightness in your muscles, you cannot eat, you become blind, you become deaf, and pretty much cannot move.
We were told to spend as much time as we could, take as many pictures, because we had about 7 months left with her.
We didn't know at the time was this Dr. Escalar was performing all kinds of research right here at Pittsburgh. I contacted her office. She let us know that it was time critical, that we could get up here as soon as possible. Every minute that we wasted, the disease was taking something else from our daughter.
The family came, and it was very clear to me that they understood that the disease had advanced enough to not allow her to ever recover movement. However, we could preserve her vision, her hearing, and her understanding. Even though she was this advanced, we had a new way to treat through transplantation that was modified here in Pittsburgh. And the family felt that between having her as a very disabled child and letting the disease progress so that she would die by 2 years of age, they would want to treat her.
We came up here to Pittsburgh and we found that hope that we were looking for.
She said that we needed to meet with Dr. Schultz here at the hospital if we were at all interested in doing a transplant.
We were able to pull out probably the fastest cord blood transplant that we've ever performed, and we have been very excited that this procedure has stopped the progression of the disease.
5 months ago was supposed to be the end of her life, and here we're looking at 10 to 15 years now because of the doctors here at Pittsburgh.
Lily is doing as well as we thought she could do from our initial evaluation. The family now has a child that has disabilities, but they are very, very happy with the fact that they are having more time to enjoy their daughter. It is by no means a perfect outcome, but it is a better outcome.
When we found Children's Hospital at Pittsburgh, it was life-changing.
The doctors, the nurses, the staff, everyone has just been so supportive, so friendly, so helpful, so compassionate. Pittsburgh creates miracles.
And Dr. Escolar specializes in these rare diseases. This is her specialty. So if there's one thing that I could tell another parent who's facing what we've been through, is you need to come here. You need to find that there is hope.
Our teams of international experts are focused on treating children with rare diseases, defined by leading standards of care, pioneering protocols, and individualized services in a world-class environment. At Children's Hospital of Pittsburgh of UPMC, you are not alone.
Thank you for listening, and this is my citation.